This topic is Tetralogy of Fallot, or commonly known as TOF or TET. Tetralogy of Fallot is a cyanotic congenital heart defect that's characterized by 4 defects. The 4 defects are pulmonary stenosis, overriding aorta, ventricular septal defect, and right ventricular hypertrophy, or enlargement. Infants with Tetralogy of Fallot are at an increased risk for heart failure due to impaired systemic circulation, and TET requires surgical correction. Infants may require more than one surgery to correct the defects, but once surgeries are completed, prognosis is usually good. Let's talk about the 4 defects that characterize TOF. The first is ventricular septal defect, or VSD. This is an opening between the right and left ventricles that allows oxygenated and deoxygenated blood to mix. The second is pulmonary stenosis. This is a narrowing of the pulmonary valve, which results in a decreased blood flow to the lungs. The third is the overriding aorta. This is where the aorta is positioned between the right and the left ventricles instead of over the left ventricle, and this allows deoxygenated blood to enter systemic circulation. The fourth defect that characterizes TET is right ventricular hypertrophy. This is an enlargement and thickening of the right ventricle, which results in ineffective pumping and delivery of blood to the body. One of the primary clinical features of TET is hypoxemia. This is characterized by fatigue, dyspnea, and cyanosis. As the infant exerts energy through feeding or crying, they're going to become cyanotic as there's not enough oxygen in the blood to perfuse the organs and to reach the extremities. Cyanosis of the mucous membrane, such as the nose and the mouth, is known as central cyanosis, and this is going to be worse with exertion. As infants with TET exert, they can often experience what are called hypercyanotic episodes, or TET spells. Due to pulmonary stenosis, infants with TET will also have a systolic ejection murmur that can be heard upon auscultation of the heart. TET is usually diagnosed before birth with an ultrasound or after birth with an echocardiogram, which is an ultrasound of the infant's heart. Let's talk a little more about TET spells. So in a TET spell, when the infant is exerting, they're going to experience hyperpnea, or an increase in the amount of respirations and the depth of respirations. They're going to have cyanosis of the face, the hands, the feet, and they're not going to be getting the oxygen they need to their vital organs. So how do we fix this? Well, the primary intervention is going to be placing the infant in the knee-chest position, or into a squatting position. This is going to increase some vascular resistance, which is going to reduce the amount of blood flow to the body that's unoxygenated and increase the amount of blood going to the lungs to receive oxygen. If the knee-chest position is ineffective and cyanosis is not improving, or if the exertion's persisting with the infant, there's a couple other things we can do. We can administer oxygen. We can soothe the newborn, so this can be reducing stimuli in the environment, like turning down the lights, reducing noise, maybe playing some calming music. You also can hold the infant in the knee-chest position. We can give an IV fluid bolus to increase circulating volume. And lastly, we can administer morphine, which reduces preload and increases the amount of blood going to the lungs to receive oxygen.